Hello students, we are just busy in setup. We are going live we are already live. I'm starting in within 2 to 3 minutes. I'm starting the lecture in 2 to 3 minutes. Okay, just wait for a while. Okay, so what I will do, we will discuss some topics, and meanwhile, I will answer your questions too. Okay, students. So NEET PG is coming in next month, and we have started a series of revision, the final experiment. So today is our first class. अनफॉर्चुनेटली बोरिंग सब्जेक्ट कम्युनिटी मेडिसिन से आपका स्टार्ट हो रहा है. इसको अपन कोशिश करेंगे कि बोरिंग ना रहे. ओके, सो व्हाट इज हैपनिंग इन कम्युनिटी मेडिसिन, बिकॉज इट इज वेरी इंपॉर्टेंट सब्जेक्ट फॉर कॉम्पिटिटिव एग्जामिनेशंस. एंड हर साल देयर आर 20, 25, 30 क्वेश्चन, समटाइम्स 15 क्वेश्चन, but average 20 questions are asking from the community medicine. So what we will do, I have divided the subject in 4 parts, and every day we will discuss some issues. Okay. Voice clarity of voice is bad. Okay. So, um, okay, technical team, please look into this. Voice is not clear, saying. Some audience are saying, request to technical team with the voice issue. This is the problem for the language. मेरी क्या आवाज नहीं भगवान ने तो वाले दिन मजाक करता है. Just wait a while, voice solve me. Voice, in the section. So we have content stuff song is student. Voice ओके, तो बताइए कि कोई
ओके, अब बताएंगे थोड़ा वॉइस के बारे में। अब बताओ शिवम, वॉइस के बारे में। वॉइस आ रही है अभी? अभी भी क्लियर नहीं है? ओके, यूट्यूब पर एक बार स्टूडेंट्स बोल दें कि अब क्लियर है। ओके, तो ये ना, एक मैंने माइक खरीदा था काफी टाइम पहले, जो कि बेचारा पड़ा हुआ था साइड में। इसको यूज किया तो चल गया, देखो कब कौन कब कहाँ काम आ जाए। थैंक गॉड, थैंक गॉड। सो सॉरी स्टूडेंट्स, हमने पहले 2 बार हमने प्रेप किया इसका, 2 बार ड्राई रन करके देखा, दोनों बार अच्छा चल रहा, पर पता नहीं जब परफॉर्मेंस का टाइम आता ना, इट इज आल्सो एग्जाम फॉर मी। जैसे नीट पीजी का एग्जाम हो, इस तरह से मेरे लिए भी एग्जाम। पर चलो अपन टाइम खराब नहीं करेंगे, अपन फटाफट स्टार्ट करते हैं। तो व्हाट आई वाज टॉकिंग अबाउट कि क्या होता है कि कम्युनिटी मेडिसिन से हर साल 20 क्वेश्चन, अराउंड 20 है ना, ±5 का एसडी लेके चले हम, तो 15 to 25 क्वेश्चन हमारे पास में आते हैं। ओके, इन इंग्लिश, सॉरी सॉरी सॉरी। So every year around 15 to 20 questions have been asked in the NEET PG exam. Okay. So what is happening? I have classified, or I have divided the course. I have divided the all community medicine in 4 lectures, and we will deal in 4 also. So today we will deal with one, that is epidemiology and biostats, and some screening portion also, and kappa statistics also. So today these are the topics that we will cover, and इनमें से whatever the exam में questions आए, the questions have been asked previously in the examination, that we will discuss. So in 2021 there were only 2 questions from this topic. Okay, only 2 questions from this topic, and 22 में 4, then 3, 7 and 6. So around 5 का average लेके चलेंगे. Approximately 5 questions have been asked from this topic. Okay, so first of all I will discuss about the epidemiological studies. Epidemiological studies से okay, hmm, Shivam, help me, there is some issue. I want full screen. Yes, this is the full screen. Okay. Okay. So in epidemiological studies, we have divided or we have classified the studies in 2 parts. One is descriptive, or initially we have observational and experimental, and after that we have experimental. Okay, then observational means when we are doing something, we are just observing, we are not doing any experiment or we are not doing any intervention. Okay, and in experimental we are doing some experiment. We have discussed so many times about this important topic, which will be asked in examination, that in analytical studies we have 4 types: cross-sectional, ecological, case control, and the cohort. And among all 4 these, ecological study is the only study where population is the study sample. Okay, we are doing study on the population, ecological, and among other 3, in cross-sectional, case control, and cohort, individual are the study population. So एक तो ये differential, one is the differential here. Descriptive is the time place person, and experimental is the exaggerated form of the cohort, RCT and non-RCT. We will discuss about. And in descriptive, we formulate the hypothesis or we generate the hypothesis. Then in analytical, we test the hypothesis, and in experimental or in RCT, we confirm the hypothesis. These are the three difference जो हमें पता होने चाहिए. Now, it was a PYQ. Which of the following studies is not an analytical study? अब analytical में just we have discussed case control, cohort, cross sectional, and the ecological. So now you can tell me which one is the answer. What is the answer here? Okay. What will be the answer? Because ecological is analytical, community trial is a trial. और when we talk about the trial का means होता है experiments. Okay. So community trial will not be analytical study. Cross sectional and retrospective, ये दोनों भी analytical है. Retrospective means case control study. Answer is B, correct. Sanvi is correct. Satish is correct. Okay. Now this is a part of descriptive study. Descriptive means because this topic is important. Time distribution is important for the exam. Why? Because there is epidemic curve in exam. In image based question they can give epidemic curve. Okay, so in time distribution we have short term fluctuation. Short term fluctuation is known as epidemic. So we have three type of the epidemic or three type of the short term fluctuation. One is point source, then common source, and then propagated. So क्वेश्चन डायरेक्टली नहीं होगा, देयर विल बी नो डायरेक्ट क्वेश्चन, देयर विल बी ए घुमा के क्वेश्चन, है ना. तो जैसे नंबर 1 इज द पॉइंट सोर्स एपिडेमिक. पॉइंट सोर्स मींस जस्ट एक्सप्लोजिव. सपोज देयर इज अ बॉम्ब एक्सप्लोजन, that will be point source epidemic. There is a food poisoning cases, cluster of food poisoning. कहीं शादी में खाना खाने गए, you went to a marriage, वहाँ खाना किया, then point source epidemic. So what will happen in the point source epidemic? The curve will rise suddenly and fall suddenly. Single incubation period, sudden rise, sudden fall. In common source repeated epidemic में क्या होगा? In common source is fixed. Source is continuously giving the cases. Source is regularly, continuously infecting the people. उस केस में, in that case, there will be no explosion. Rise may be sudden, but fall may be graceful. Okay. Then propagated epidemic like COVID, like any infectious origin, propagated epidemic will be our answer. So question have been asked in the exam that hepatitis A or hepatitis E or any infectious disease, इसके बारे में if they will ask, answer will be propagated epidemic. Okay. And when there is propagated epidemic, we have to break the chain of transmission. It is correct. So now modern epidemic pe so many times they can ask about the modern epidemic or slow epidemic, because these diseases slowly evolve, slowly increase over the period of time, but a long time, over decades, 10 years, 20 years. So NCDs are the diseases जो last 10 to 20 years में evolve हुई हैं. Periodic fluctuation में cyclic trend and the seasonal trend important है. Seasonal trend every season में, like after rainy season there will be cases of the mosquito-borne disease. In every winter there are cases of upper respiratory tract infection, that is seasonal trend. And cyclic trend, every 2-3 years में if there are cases like measles cases in every 2-3 years, that is cyclic trend. Road traffic accident every weekend, क्योंकि weekend में क्या करते हैं, पार्टी करते हैं, after doing party race driving करते हैं और then fall for accident, that is also a cyclic trend or cyclic event, that is not a seasonal event, है ना. किसी भी सीजन में पार्टी कर सकते हैं ना, सैटरडे संडे. तो then long term fluctuation is very important. There is a confusion between long term fluctuation and the modern epidemic. Both look similar but they are different. Over 50 years if there is changes, that will be long term fluctuation. Over 10 years there is changes, there is a modern epidemic. Okay, long term fluctuation or secular trend, यहाँ पर क्या होगा? What is main point? That is, in secular trend we will follow the rise of the disease and fall of the disease. If some diseases are not happening in last 50 years or decreasing in last 50 years, suppose cases of TB are falling down, suppose cases of mumps or measles or smallpox are not in the community, that is secular trend. तो सेक्युलर ट्रेंड क्या होगा? चेंज इन द इंसिडेंस ओवर ए लॉन्ग पीरियड ऑफ टाइम विल बी सेक्युलर ट्रेंड. ओके, देन क्वेश्चन है which of the following is characteristic of a single exposure common vehicle outbreak. Okay, single exposure common vehicle outbreak बताओ. Which of the following is characteristic of a single exposure common vehicle outbreak? Single exposure common vehicle, when there is single exposure, what will happen? Okay, what will happen? Single exposure and vehicle common, like bomb blast, like Bhopal gas tragedy, like Chernobyl accident, like any food poisoning cases in the community. Okay, so the cases will be explosive, there will be no secondary wave, there will be all cases in a single incubation period, यही सब होगा, and there will be no secondary waves. So frequent secondary cases नहीं होंगे, there will be no frequent secondary cases. Okay, severity increase with the increasing age, because bomb blast में how we can say in the bomb blast severity increase with the increased cases? No. Then explosive, so C will be the correct answer. सानवी यार तुम तो बड़ी इंटेलिजेंट हो, है ना? C is the correct answer. Explosive. Anyone else? Okay. Okay, this question is the latest PYQ in last 2-3 years. An epidemic of hepatitis A is an example of. अभी जस्ट मैंने बताया आपको, एग्जांपल अभी मैंने दिया भी था. हेपेटाइटिस ए एपिडेमिक है. सो व्हेन देयर इज एन एपिडेमिक, when there is an epidemic in infectious origin, because epidemic में we have point source, we have continuous exposure, we have propagated. So hepatitis A is an infectious disease. तो सर थोड़ा स्लो. ओके सॉरी स्लो हो जाएगा. तो epidemic of hepatitis A is an example of. So I have discussed 3 type of the epidemic with you. Short term fluctuations. In that, number 1 was the point source epidemic, single exposure like bomb blast. Simple याद रखो, है ना? Second is continuous exposure. Continuous exposure, suppose in your hostel there is a water tank जहां से you are taking water and that is infected. What will happen? Sudden cases होंगे and gradually fall होंगे. There will be propagated epidemic. Third number, propagated was infectious origin. Hepatitis A is an infectious origin disease. So answer will be propagated epidemic. C will be the answer. Okay. Now we can move forward. I think सबने जवाब दिया है, राहुल ने भी दिया है, सतीश, शानवी और अनन्य अरोड़ा आपने बी दिया है. बी नहीं होगा बेटा, सी है आंसर. बी आई थिंक पिछला वाला आपने दे दिया या तो. Okay, now analytical epidemiology, we will discuss 4 types of the analytical epidemiology. Ecological, cross sectional, case control and the cohort. देखो इसमें मैं आपको we should know about the other name of the studies. आजकल क्या है, nowadays they are not giving with the name of case control, they are giving with the name of retrospective, they are not giving with the name of cohort, they are giving with the name of the prospective. Okay, so ecological study is also known as correlation study beta. correlation study अब कह दिया हमने इकोलॉजिकल को. कोरिलेशन कोएफिशिएंट क्या होता है? व्हाट इज कोरिलेशन कोएफिशिएंट? कोरिलेशन कोएफिशिएंट वी यूज्ड टू कैलकुलेट जब वी आर मेकिंग ए स्कैटर डायग्राम. स्कैटर डायग्राम में r इज इक्वल टू -1 to +1, स्मॉल r इज इक्वल टू -1 to +1, दैट इज कोरिलेशन कोएफिशिएंट. ओके, तो कोरिलेशन कोएफिशिएंट में क्या हो जाएगा कि वहां पर -1 to +1 वैल्यू हम कैलकुलेट करते हैं. इकोलॉजिकल स्टडी, कोरिलेशन स्टडी, स्कैटर डायग्राम, कोरिलेशन कोएफिशिएंट, ऑल आर टुगेदर. ओके, एंड इकोलॉजिकल स्टडी के बारे में थोड़ा हम आगे डिस्कस करेंगे. देन क्रॉस सेक्शन स्टडी, क्रॉस सेक्शन स्टडी, क्रॉस सेक्शन का मतलब है दो, वी कैन मूव इन टू डायरेक्शन, आइदर ओके, वन स्टूडेंट सेइंग हेपेटाइटिस वाले का आंसर क्या है, सी है, यस बिल्कुल सही है, हेपेटाइटिस ए का आंसर सी ही है, प्रोपागेटेड एपिडेमिक था, वाई प्रोपागेटेड एपिडेमिक, क्योंकि इन्फेक्शियस है। प्रोपागेट का मतलब व्हाट इज द मीनिंग ऑफ प्रोपागेटेड, प्रोपागेट मींस दैट विल मूव फॉरवर्ड, आगे से आगे जाएगा, प्रोपागेटेड। तो हेपेटाइटिस ए है, इट विल मूव फॉरवर्ड, इन्फेक्शियस है ना, वन पर्सन टू अनदर पर्सन इट कैन गो, हेपेटाइटिस बाय ओरोफिकल रूट, दैट्स व्हाई। ओके, नाउ coming back to the analytical epidemiology, cross sectional, so we can move either horizontally or vertically. If we move horizontally, it is longitudinal. If we go vertically, we will cut anything in two pieces, that is cross sectional, है ना। आप if we cut cucumber or we cut carrot directly, it will be cross section. So what we will do in cross section, we made a section in the time. Okay, currently 9 July 7:57 p.m. how many patients of COVID in your hospital, that is cross section. Now COVID ka there will be 0 patient, right now there are 0 patient of the COVID, it means prevalence of COVID is 0 currently. If you go hospital and if you will find out how many patients of diabetes right now in your hospital, that will be anything something na, that will give some value, because diabetes ka patient to there will be sure. Okay, so prevalence we used to calculate for the non communicable disease, that is cross sectional, and in cross section we can have point prevalence for a particular point of time, or we can have period prevalence from a point of time to another point of time, like from 1st January to 31st December. Okay, for whole 1 year how many cases you have of any particular disease, that is cross sectional. Okay, so ecological and cross sectional are theoretically, for calculation purpose, case control and the cohort. How? Case control is known for the odds ratio. Case and control, when I was in the UG, when I was in 3rd year, when I first read about the case control, so I thought there is a case, there is a control, that's why it is case control. But I remember it like this, we have no control over the case. Okay, we have no control over the case, because case is already happened, patient is coming with the disease, that's why. So in case control, individual is the study population, also known as case reference study. Patient is coming with the outcome or the result or the disease, and exposure usko exposure happened in the past, that is the case control. Now cohort study, what is cohort? Cohort is also known as prospective or follow-up study. In prospective study or in follow-up study, patient is coming with the exposure, or our study population, we have study population with the exposure, and we waited for follow. Okay, suppose a person came with us, and a person is saying I am smoking cigarette, 5 cigarettes per day, and what we are doing, we are waiting for the development of the lung cancer in that person, that will be cohort study. But problem kya hai? What is the problem in cohort study? Because we are waiting for the development of the cancer. Are you a doctor? You are inhuman. You are waiting for the development of the cancer. You know the person is having, a person is taking 5 cigarettes per day, and in spite of or despite of you are asking him to quit the cigarette, you are waiting for the development of the cancer. This is inhuman. So this is the ethical issue with the cohort study. Same ethical issue with the RCT. Okay, so cohort study, what is the ethical issue? That we waited for the development of the disease. This is the ethical issue. Okay, now important point, cohort में AR है, AIR वो हम डिस्कस करेंगे क्या है. Now one MCQ. These all MCQs are the PYQs asked in the either NEET PG or NICT or any other exam, but all are the PYQs. Which of the following research method studies have only people who are initially free of the disease of interest? This is the question. Okay. Which of the following research methods studies have only people who are who are initially free of the disease of interest? Initially disease नहीं था इन लोगों में, and later on disease developed. Okay, can you tell? So if we use the previous table, just I am referring this table. These are the 4 studies: ecological, cross-sectional, case control, the cohort, and study population starts with both exposure and outcome happened already in ecological and the cross-sectional, and case control starts with the outcome to backward direction. That is why we are naming it retrospective, and cohort is prospective. So what will be the answer here? Okay, Rahul is right. Satish is saying C. Beta, prevalence survey. Prevalence study is the cross-sectional. I just told you that in cross-sectional study, point prevalence we can calculate, or we can calculate period prevalence. So point prevalence and period prevalence, these are the part of cross-sectional. Cross-section matlab like a photo. We just click a photo, and we, after taking the picture, we can count the how many people were in the picture. That is prevalence. Prevalence means the total number of the cases. Okay. So the answer, what will be the answer? Someone is saying B, case series. Case series is the series of patients. Okay, case series is the series of patients. So case series, even we didn't discuss about the case series. Case series is a lame study. Case series, what is case series? We have seen a patient in OPD of a patient of a Wolman syndrome. Okay, एक नई disease है Wolman syndrome. We have only 5-6 patient. Wolman syndrome के 50 patients हैं worldwide only. So 5-6 patient है, तो we cannot do any study. So what we do? We do a case series. Case series is not a study, ढंग की study नहीं है. Case series, it is obsolete now. So answer will be cohort. देखो now अब सबकी बत्ती जली दिमाग की. Now everyone say the answer is cohort study. Okay. Next, all of the following have individuals as unit of study except all of the following. All of the following have individuals as unit of study except. Okay, in cohort study, what we do? In cohort study, we have group of the people, and we are using variables of each and every person. Suppose we are studying development of the cancer in patient in a person who is exposed to smoking. Okay, so this is a cohort. We are using individual here. In case control study, so again we are taking individual as a study population. In cross-section study, again we are using individual. And in ecological study, we are not going to any patient. Ecological study में हम patient से नहीं मिलते. We do not meet the patient in ecological study. Okay, we do not meet the patient in ecological study. कितनी important बात है ये. We do not meet the patient. How it is possible कि हम patient से मिले नहीं और study हम कर लें? So without going to the patient, we just use data of the population. So answer will be here ecological study. Okay, answer will be ecological. D is the answer. सभी ने सही बताया है almost. Now This is the case control study framework. I have taken only important point here. Case control study, the steps and all, no. Just take an important point, odds ratio calculation, because odds ratio calculation last year they have asked in the INI-CET. That's why it is very simple. We have a framework of 2 by 2. This is 2 by 2 framework. 2 by 2 framework mein we have cases and control, exposed and non-exposed. Smoker are the exposed, non-smoker non-exposed, cases and control. Control means the person without the disease are the control here. Okay. So in this question, they have given smokers, total smokers are 88. Out of them, 33 develop lung cancer and 55 do not develop lung cancer. And in non-exposed, in non-smokers, out of total 29 non-exposures, 2 developed lung cancer and 27 do not. So what we have to do? We will do just AD by BC. A into D, B into C. This is we have to do A into D, B by C. 33 multiply 27 divided by 55 divide and 2. 55 multiply with the 2. So 8.1 will be our answer. This is the odds ratio. Very simple. कुछ नहीं इसमें करना हमें. It is very simple. Now okay. अब in case control study, what are the biases? Biases क्या है case control study में? Suppose you have two groups, one group of case and one group of the control. तो जो case का group है, the person with the disease, okay, and control is not without the disease. अब sometimes there are a confounding factor, a factor which is associated with the effect and outcome also. The factor which is associated with the effect and outcome both, it is known as confounding factor, which we can remove by the matching. Okay, age can be a matching. Age can be a confounding factor which can remove by the matching. Gender can be a confounding factor. Okay, age and gender. अब यहाँ पर so how can we explain about the confounding factor? आप ऑलरेडी साल भर से पढ़ रहे हो, मेरे प्रीवियस लेक्चर्स पे भी कंफाउंडिंग फैक्टर मैंने काफी डिटेल में बताया. सपोज अ पर्सन इज टेकिंग अल्कोहल एंड वी आर स्टडिंग इफेक्ट ऑफ अल्कोहल ऑन द गैस्ट्राइटिस, because in many person alcohol do gastritis, but in many person soda also do gastritis. The person who is drinking soda with the alcohol, if he developed gastritis, he will claim the soda, not the alcohol, है ना? He will claim the soda. So because alcohol and soda both are doing gastritis, but we have to nullify the effect of soda. So what we will do, we will include the person in the study who drink alcohol only, not the soda. Understood? So soda will be confounding factor here. Okay. Recall bias is a problem, memory bias is a problem, because we are dealing with the case who had disease and history of exposure. So he might not remember about the history of exposure. Selection bias, because if any person who is selecting the study subject, if know about the patient, selection में कुछ भी problem हो सकती है. Bergsonian bias, Bergsonian bias is the hospital admission rate bias. Exam में directly they will ask what is Bergsonian bias or hospital rate admission bias, because every day there are different type of the patient admitted to the hospital. Someday they are patient of the URI, someday they are patient of the diarrhea. So this is hospital admission rate bias, that is Bergsonian bias. And bias in obtaining information when interviewer know the patient, that can be interviewer bias. Okay, now important one, nested case control study. Nowadays they are asking a question from the nested case control study, which is predominantly a cohort study. Name is the nested case control, but study is the cohort study. Okay, so what we will do, we will select a population with the exposure and age case developed in that population. We will take that case for the case control study. Okay, so there is a population. There is a population, suppose in an area, this is an area. Here, this total population, suppose a population living nearby some mining area. Okay, population is living nearby a mining area, and this is the population which is exposed to some dust particles. Okay, now what we will do, we have chosen the population, this is our cohort. Now we will wait for the development of the disease. After 10 year, 15 year, if some persons developed silicosis, so we will select that person as a case, and the person who do not develop the disease, we will select that as a control. Okay, this is case and this is control. So that's why it is a case control study, but predominantly it is a cohort study. Now, next is nested case control study is a type of. What is nested case control study? देखो अभी just मैंने डिस्कस किया, अभी आपको याद है भी नहीं. Okay, tell me what is nested case control study? Okay, tell me what is nested case control study? True. I am waiting for your responses. Nested case control study. It is a prospective study. Okay, or retrospective. Nested case control is not retrospective. Okay, there is a war in the comment box. Someone is saying A, someone is saying B, someone is saying D, C भी बोल दो. Okay, so cross sectional, true for first. Cross sectional cannot be the answer. Just I discussed here nested case control study. Just go through the literature na. It is predominantly cohort. Predominantly cohort लिखा है बेटा. A population is selected with the exposure. Just I explain you. Suppose we will select a population, we will make a cohort of a population, and we will wait for the development of the disease. When disease is developed, we will take case that disease population, we will take them as a case, and the other population with the same exposure, we will take them as a control. So this is either a case control or it might be a cohort. Either it can be retrospective or it can be prospective. दो ही चीजें भी पॉसिबल है यहाँ पर. either retrospective or prospective. ये only two answers we can be here. Only two answers can be possible. Descriptive and cross sectional will not be answered. Now, because name is saying nested case control, many of the students will directly answer case control is retrospective. What a twist examiner have been given, case control ki jagah they have given retrospective. But this is wrong, because nested case control study is predominantly a cohort study, and cohort is prospective. So answer will be prospective here. Answer will be prospective. Don't listen if somebody is saying it is retrospective. Okay, answer is prospective. B will be the answer. A will not be answer. We are studying it in the case control. Name is nested case control, but it is not a retrospective. It is prospective, because We selected population and we waited for the development of the disease. We selected exposed group and waited for the development of the outcome. So this is a cohort study or prospective study. Okay, चलो अब क्लियर हुआ. Now next is a study compared 150 children with a particular disease with 300 disease. 3 children, 1. Okay, you just go through the question. Okay, so what is happening in this question? A study compare 150 children with a particular disease with 300 disease-free children to examine past experiences that may contribute to the development of illness. What kind of study is this? So what we are doing here, we are comparing 150 children with a particular disease and 300 disease-free. So 300 disease-free, what are they? They are control. And we are examining past experiences, yani ki we are talking about the retrospective direction, we are talking about the backward direction. Okay, we are talking about the past experiences that may contribute to the development of the disease. So this is simple case control study. इसमें कहीं we do not waste time here. The answer will be case control. Simple answer है. Okay, and all of you above are giving the correct answer. Now all can be used as controls in a study of genetic condition, except it is a very important question, and it is a PYQ. All are the PYQs, but it is also a PYQ. All can be used as control in study of genetic condition. Okay, if a person with genetic condition and we want to use the control, so you know about the migration studies, or you know about the genetic studies. In genetic studies, we used to determine whether a disease is due to genetic condition or due to environmental condition. So what we will do, we are taking control from the same environment. We are taking control from the same environment and now compare the disease of both person. Okay, case person and the control person. Case person is the person with the genetic disease. Control person is the person from the same environment, same exposure. Okay, so here hospital control are the person. Suppose a person with the genetic disease is admitted to a hospital and other person from the same hospital can be taken as a control. Sibling control को भी डिस्कस करेंगे, we will discuss this later. Neighborhood control are the persons who are living in the same environment, so we can take them also as a control. General population of the same area, we can use them as a control. Now sibling control, who is the sibling? Sibling is the brother or sister of same parents, brother and sister from same parents, so they will share the genetics also. And if they will share the genetics, there is high chances of the development of the disease. So we cannot take this sibling as a control. We cannot take this sibling as a control. Why? Because this sibling will have same genetic condition. Then how will it be a study? Suppose you are doing a study of Down syndrome. Okay, study of Down syndrome. And Down syndrome in a particular area, suppose North India, South India, West India, kahin par bhi, in any city, you are studying about the Down syndrome. So Down syndrome patient, now if there are increasing cases of Down syndrome in a particular area, you will suspect what are the environmental condition leading to the Down syndrome. But the same person, if having another brother or sister with the Down syndrome, we cannot use that as a control. So controls are from the same population. Okay, siblings we cannot use as a control in genetic condition because दोनों का genetics same होगा. So answer will be B here. यहाँ confuse नहीं होना. Genetics, whenever talking about the genetics, just go to the gene, same gene, different gene. Okay, hospital control will have different gene, sibling have same gene, neighborhood control have different gene, general population have different chromosome or different gene. So sibling control is the odd man out. ऐसे भी you solve this. Okay, so answer will be B here because in genetic condition में we have to look for the gene or genetic abnormality. Okay, now next will be understood sibling wala, everyone understood. Okay, why genetic condition में in genetic condition we do not use sibling as a control because they share common genes with the case. This question, this question was in the full course at DigiNerve, and recently in the INI-CET they have been asked this question. In an investigation to study the effect of smoking on renal cell carcinoma, it is observed that 30 of 50 patients were smoker as compared to 10 out of 50 control subjects. So in that case, we have to make a 2x2 framework. Okay, this is the 2x2 framework. And in 2x2 framework, always do one thing, exposed and non-exposed, diseased and no diseased. Okay. Now what is saying that it is observed that 30 of the 50 patients were smoker. 30 of the 50 patients, these are the patient disease. Here 30 of total 50 patients were the smoker and were compared to 10 out of 50 control subject, means 10 out of the control, 10 control out of the 50 were the smoker. Okay, so this is how you will make a 2x2 table. First, it is observed that 30 out of 50 patients, yani total out of total 50 patients, 30 were the smoker, so 20 will be non-smoker, as compared to 10 out of 50 control subject. So 50 control subject में से 10 were the smoker, so 40 will be non-smoker. Now do the odds ratio of renal cancer associated with the smoking. Do AD by BC, 30 into 40 divided by 20 into 10. Simple calculation, answer will be 6. Okay, and this lame question, I'm saying this is very lame question, and it was asked in the INI-CET this year. Can you believe INI-CET में इतना easy question they have asked? Now, an odds ratio of 1 indicates that association between the two factors is, okay, बताओ, odds ratio of 1 indicates that the association between the two factor is 1 is the odds ratio. Okay, just go through the table. If we have 50 patients and 50 controls, 25 in the exposed, 25 in the non-exposed, 25 in the exposed, 25 in the non-exposed. What does it mean? It means among the 50 patients, 25 were smoker, 25 were non-smoker, and among the control, 25 were the non-smoker, 25 were the smoker. It means there is no effect of the smoking in case and the control. Now calculate odds ratio. 25 into 25 divided by 25 into 25, the answer is the 1. So 1 odds ratio, what it indicate? वन odds ratio, what it indicate? It indicate क्या एसोसिएशन है, व्हाट इज द एसोसिएशन बिटवीन स्मोकिंग एंड कैंसर हियर. If a person is doing smoking, is a person is exposed, out of 50 25 have the disease, and out of 50 control 50 non disease person, same smoking का exposure है उनमें. Okay, so it means there is no association. There is no association. If odds ratio is 1, exact 1, there is no association. Okay, so association between the two factors does not exist. There is no association. Answer will be D. Okay, and whenever there is an answer like does not exist, we usually left it, है ना, हम छोड़ देते हैं. We usually leave such type of the answers. Does not exist तो कैसे होगा? Perfect नहीं हो सकता. It cannot be perfect. Either it can be low or it can be high, but perfect, there is no perfection. Okay, in medical there is no perfection about the because cause effect relationship, to establishing a cause effect relationship is a difficult thing. Okay, someone is saying smoking से cancer नहीं होता. Someone is saying there is no cancer due to smoking. I used to smoke, but I have no cancer. So it is difficult to establish a cause effect relationship. That's why perfect will never be an answer. In medical, there is nothing perfect, nothing only, nothing always. In any MCQ, if you see the option only, if you see the option always, that will be a wrong option. Always, only, perfect, these are always wrong options, है ना. हम ध्यान रखना, remember it, ये आपके एग्जाम में काम आएगा. It will be useful. No always, no only. Always only are always wrong. Always and only are always wrong. Now, about the cohort study. So cohort study, also known as prospective study, also known as longitudinal, also known as incidence study. Okay, also known as forward looking, because in cohort what we do, we will make a cohort, we will select study subjects. These are the exposed population, and in exposed we will wait for the development of the disease. Similarly, in non-exposed we will also wait for the development of disease and no disease. So we are moving forward horizontally. That's why it is longitudinal study. It is prospective because we are following. Incidence study because out of 100, if 10 people develop the disease, it is 10% incidence. That's why it is incidence study. Forward looking, effect to outcome, effect means exposure, है ना. Exposure to outcome, and in cohort we have air or pair, है ना. Cohort study is a difficult study to establish, to follow, because it's a long duration study. So when we do long duration study, we leak air, है ना, हवा निकल जाती है कोहॉर्ट करने में. क्या हवा निकल जाती है? व्हाट एयर? ए फॉर एट्रीब्यूटेबल रिस्क, आई फॉर इंसिडेंस, आर फॉर रिलेटिव risk. Attributable risk, incidence, and relative risk. These three things we calculate in the cohort study. Air or pair. Pair means P for population attributable risk. So attributable risk or population attributable risk almost similar है. So just remember this mnemonic. कोहॉर्ट में एयर है, एयर इन द कोहॉर्ट. कोहॉर्ट करते हैं तो एयर निकल जाती है. कौन सी एयर निकल जाती है? एट्रीब्यूटेबल रिस्क, incidence, and the relative risk. It will be useful for exam. They can ask that which of the following is not a significant of the cohort study. Option में attributable risk, incidence, relative risk, and the odds ratio. The answer will be odds ratio because odds ratio is related with the case control. Okay. Now, what are the biases in the cohort study? Selection bias will always be a bias because we are selecting a population. Information bias. Suppose what is happening in the cohort study. In cohort study, we have two groups. One is exposed group, another is the non-exposed group. Now we are looking for the development of disease in exposed, disease, no disease, disease, no disease. If the person, the supervisor who is looking after the cohort, if he know about the exposed person, so he will look more carefully for the development of the disease in exposed person rather than in the non-exposed person. So this is the information bias, information about the patient. Okay. Attention bias. What is attention bias? Because the person, when we are looking, we are seeing a person who is in the study, he know that I am being observed, so he will change the effect. Okay, he will change the behavior. That is known as Hawthorne bias. Similarly, there is attention bias. Some person in the study seeks the attention. Okay. Apprehension bias is anxiety bias because they are in the study. Okay. Now, what are the disadvantages? It is very important. Why? Because we have two main studies, case control and the cohort. In case control and cohort, we have advantage and disadvantage both. So what we do, we just remember the disadvantage of the cohort. Remaining will be the advantage of the cohort, and vice versa with the case control. So major disadvantage with the cohort, a long duration study, a time, effort, money. Here, time, effort, and the money will be consumed. Okay, it is unsuitable for the rare disease. Rare disease are the disease where we do not know that they will develop or not. So for rare disease, we have cohort. Sorry, for rare disease, we have case control study. For rare exposure, we have cohort. Okay, important one है ये. For rare exposure, we do cohort study. For rare disease, we do case control study. Okay. Important one is loss to follow-up. Loss to follow-up is also known as attrition because we included 100% in our study, and with the duration, some person may die, some may change the area. So this is known as loss to follow-up, which is a problem in the cohort study. Then study is longer, and important one, 6 point, a person may change the behavior after entering in the study. If a person who is a smoker after entering in the study, smoking quit kar diya, so that will not be exposed for us. This is known as have thrown bias. Okay, and only one or few risk factors can be studied. Initially, when we enroll the person in the cohort study, we choose the exposed person, either one or two exposure we can study. Okay, so this is the problem with the cohort. The important one is the loss to follow and unsuitable for the rare disease. Okay, for rare disease, we do case control. For rare exposure, we do cohort study. And person may change the behavior after entering in the study. Now, this is the difference between case control and cohort. We have already discussed about it so many times. The important one here, this one, exposure. Case control में we can study about the multiple exposure. In cohort, we can study about one or two exposure only. Okay, ethical issue is with the cohort study. The one is asking, sir, how much time you will take? At least 9:30 तक तो चलेगी क्लास अभी. Okay. Now, all of the following are advantages of case control study, except. So, just give the answer. All of the following are advantages of the case control studies, except useful in the rare disease. Okay. For rare disease we can do case control, because rare disease means the disease जो कभी कभी हो रही है ना. There are few cases. If the cases are few, the cases will come to us only, no exposure. Only cases will come to us. So what we will do? We will do case control, because case is coming to us directly. है ना. So case is coming to directly in rare disease. So okay, we will do rare disease के case में we will do case control study. Relative risk can be calculated. No, है ना. Relative risk cannot be calculated. In relative risk, what when relative risk calculated, cohort में AR है, AR in the cohort, attributable incidence and the relative risk. So relative risk can be calculated. No. Odds ratio, yes. Cost effective and inexpensive, yes. So answer will be B here. Okay, बहुत simple है. Hawthorne effect is seen in Hawthorne effect. ये we have discussed. Okay, A answer who no, A will not be the answer. Advantages of the case control study, except which of the following is not an advantage? Relative risk cannot be can be calculated. No, relative risk cannot be calculated. We can calculate relative risk with the cohort study only. So answer will be B here. And case control is useful for the rare disease. Yes, this is correct. Now Hawthorne effect is seen in. What is Hawthorne effect? Hawthorne effect is a effect when a person after enrolling in the study change the behavior in cohort study. Okay, we have already discussed. The answer will be here, cohort study. Next is the incidence of carcinoma cervix in women with multiple sexual partners is 5 times the incidence seen in those with a single partner. Based on this, what is the attributable risk? Okay, what is the attributable risk? What is attributable risk? Attributable risk is the risk associated with the exposure. Associated with the exposure. How? Suppose incidence of carcinoma cervix in women with a multiple sexual partner is 5 times the incidence seen in those with a single partner. We have multiple partner women, we have single partner women. Single partner women is saying I have one case, है ना. Single partner का, if we have one case of single partner, we will have 5 cases of the multiple partner, 5 times. So out of this, in attributable risk is saying that how many cases are purely due to exposure. Multiple में we have 5, but one is normal, so there will be 4 exposure are due to 4 cases are due to exposure. So 4 by 5, total 80% are due to exposure. Okay, 80% will be answer here. Okay, understood how we calculate attributable risk? In attributable risk, disease among exposed 5 times, disease in non-exposed, that is 1 time, divided by disease in the exposed. 5 minus 1 into 5 into 100%. That is 80% will be the answer. Okay. Now it is probable that physician have a higher index of suspicion for TB in children without BCG scar than those with BCG scar. This is so, and an association is found between the TB and not having BCG scar. The association may be due to. बहुत important question है. It is very important. Can anybody tell the answer? It is probable that physician have a higher index of suspicion for TB in children without BCG scar than those with BCG scar, because BCG scar is formed after BCG vaccination. So if a person or if a child is having BCG scar, It means BCG vaccination he has taken, and there will be less chances of the TB in that person. Okay, so physician, what physician will do? Physician will see a child with the BCG scar. It means scar is present. He has taken BCG vaccine. It means there is a less chances of development of the TB. And this information, the physician is an interviewer here. He has some information. So the problem is the interviewer bias. Okay, this is the interviewer bias because physician is interviewer here. Physician is looking for the BCG scar and no BCG scar. The physician is examining the children, okay, for the development of the TB. So this is so an association is found between the TB and not having BCG scar because physician is preoccupied with this thought that BCG scar if present, it means BCG vaccine have been taken. It means there is a less likely chances of the tuberculosis. That's why. So this is the problem of that physician, that why you are thinking like this, why you are looking for the BCG scar. This is the problem of physician. The physician is an interviewer here. So answer will be B here, interviewer bias. Okay. Next is most appropriate method to know about contribution of the risk factor. So if a risk factor, is contributing to a disease, just I told you in a question that a woman with a multiple sexual partner will have 5 times more chances of the development of the carcinoma cervix in compared to the single sexual partner. Okay, so here what is the risk? Risk is the multiple sex partner is the risk. Okay, and in how many patients? Because 5 minus 1, 4 patients were on the risk. Okay, because if there is no risk factor, at least one will be the patient. One patient will be there if there is no risk factor. So risk factor is directly linked to the attributable risk. Attributable risk is the reason जिसकी वजह से because of this we have seen the cases. Okay, ये कैसे हुआ? How we estimated? How we talking about the attributable risk factor? Or how we are why we are talking about the attributable risk? Because if a person who do not develop disease even after smoking, okay, even after smoking a person is not develop disease, and a person who do not smoke might have lung cancer. So these are the person who saying that we are not doing anything, we are having disease, or I am doing everything but I am not having disease. These are the person who are saying about the attributable risk. Okay, so here answer will be B, attributable risk. Now ecological study, I already discussed about the ecological study. In ecological study, what we do, we collect the data from the population and we just give our verdict. Suppose in India, we can say for India that prevalence of obesity is very high in India. Okay, so this is general statement. If we take a data of the weight of all person from our country, we can estimate the prevalence of obesity is high in India in comparison to Japan or in comparison to China. So we can say obesity is high in India, but a person who is not obese, a person who is not obese will say this is a wrong statement. Why you are including me in this? I am not obese. This is known as individual variation or ecological fallacy. So this is I am talking about if a individual without character will fall in the group. A person is not obese, but we are saying in India there is prevalence of obesity is high. So individual who is not falling in this group, individual who is not obese will say why you are including it me, why are you including me in this is ecological fallacy. And we calculate correlation coefficient for the ecological study. Okay, how we take data of, suppose we have taken data of our country, of all states from our country, data of consumption of fat consumption. Okay, so we will find out the person, we have taken data and we made a scatter diagram and fat consumption along with the coronary heart disease. So the state with the high fat consumption will have high CHD cases. Okay. So there will be a scatter diagram and there will be a line. That line will show correlation coefficient. The value is small r from -1 to +1. If the value is toward the +1, there is positive correlation. If it is toward -1, it is negative correlation. The value always lies between -1 to +1. It will be never greater than +1, never less than -1. It means +2 or -2 will never be answer in case of the स्कैटर डायग्राम और कोरिलेशन कोएफिशिएंट. बहुत इंपॉर्टेंट है, क्वेश्चन आ चुका है एग्जाम में, है ना, बहुत इंपॉर्टेंट है. सो दिस इज द क्वेश्चन. अ पर्सन वांट्स टू स्टडी अ डिजीज एक्स and fat consumption. He collected data for a number of people affected with X from the government hospital and details of fat consumption from the food industry. This type of study is known as. So what the person is doing? Person is collecting the data of fat consumption from food industry and the data of disease from the government hospital. So he did not meet with the patient. Such type of studies are known as ecological study. Here data of population has been taken. Okay, data of population has been taken. Such type of example maybe they can ask the data like sale of the condoms and the total fertility rate, sale of the condom with the NC registration, anything they can ask, but the question will give data is taken from a agency might be government agency, might be private agency, anything, but patient say there will be no contact, so answer will be ecological study. Now experimental epidemiology mein there is not so much about this. In experimental studies, experiment means RCT. RCT is the randomized control trial. Okay, the ecology wala the whole person Selva, Rahul Kumar and Rushali, everybody, you all are right. The answer is B. Now in experimental epidemiology is the randomized control trial. We talk about randomized control trial or non-randomized control trial. RCT is the all-time superior study. It has feature of the cohort, but with the experiment. So there will be some experiment or there will be some intervention, and when there is experiment, there is a problem of ethics, but because we are doing experiment on the human, so there will be problem of the ethics. Randomization we will do, and we have two type of the study design in RCT: concurrent and the crossover. In concurrent, we have two group, A group and the B group, experiment group and the non-experiment group. Both will follow. Both group will be same throughout the study period, but in crossover what we will do, group A and B, we can change the pattern. Group A become experiment to non-experiment and group B become non-experiment to experiment. This is the crossover. Okay, now blinding is important for when we are doing RCT. So we have three type of the blinding. In single blinding, patient do not aware about the what treatment or intervention patient is taking. In double blinding, patient or subject and the observer both do not aware about the treatment whatever subject is taking. And in triple blinding, subject, observer and the investigator, all three do not know about the study treatment. Okay, next In a double blinding clinical drug trial, this is the question. In a double blinding clinical drug trial, each patient, what will is the correct? What is the correct here? In a double blinding clinical drug trial, okay. So in a double blinding, subject will always do not know anything, either single or double or triple. So patient to will not know, okay. And patient do not know which treatment they are receiving, and the observer will also not know. But there is no option about the observer here. So what is the option? Each patient receives a placebo. Each patient receives a placebo. Wrong answer, because half of the patient will receive experimental drug, half of the study population will receive placebo, okay. So this is the wrong answer here. Then each patient receive both treatment. No, each patient will not receive both treatment. Half receive treatment, half receive placebo. This is also wrong. The patient do not know which treatment they are receiving. Yes, this is correct answer. But this line, this sentence is correct for the single blinding also, double blinding also, and the triple blinding also. This statement is correct for all three things. Now, patient do not know that they are in drug trial. This is wrong. Patient is no. Patient is knowing. We took the consent from the patient that you are involved in the drug trial. So this is also wrong. So answer will be C here, है ना? C will be the answer. I think सभी ने सही बताया. C is the correct answer here. Okay. Next is, all of the following are true in RCT except baseline characteristic of intervention are similar in both arms. Yes, we have to take baseline similar in both arms. Investigator bias is minimized by the double blinding. Okay, yes, double blinding. Why we are doing double blinding? To minimize the investigator bias. Sample size required depend on the hypothesis. Yes, what is the hypothesis? क्या हमने hypothesis बनाई है? Sample size will depend on that. The dropout from the trial should be excluded from the analysis. This is wrong. Dropouts को we will not exclude from the analysis. Suppose a person enroll in the study, and the study of 6 month duration, and he were in the study for 3 months. After 3 months, the person left the study. So what we will do, we will use that 3 month data for the analysis. So dropout का जो data है, the data of dropout will not be excluded. We will use that data for the analysis. Okay. So D will be the correct answer here. Okay. Very important question. ये भी PYQ है. Then random in randomization in clinical trial means, random means equal chance and non-chance of selection. Randomization means equal and non-chance of the selection. What does it mean? Randomization means, suppose we have to take 10 people out of 100. So we will select, we can select anyone from 100, we can select anyone. So what are the chances? 10% chances of a person to be selected in the study. So 10% for everyone. This is the equal chance and non-chance. If we have to select 10 out of 100, that is equal and non. 10 out of 100 means 10%. This is the randomization. Okay. Equal and non-chance. Repeated question hai. Now this is important one, phases in the clinical trial. So many times questions have been asked from this. Preclinical, initially in phases of clinical trial, we have preclinical phase when we do trial on the animals, also known as pre-testing. In clinical phases, we have 5 phases: 0, 1, 2, 3, 4. Total 5 phases we have from 0 to 4. In 0 phase, we have human healthy volunteers, HHV, healthy human volunteers. In initial 2 phases, we have healthy human volunteer. In phase 0, we do microdosing. Microdosing means we will give minimum dose to the healthy human volunteer. Minimum dose, microdose. This is the zero phase. And we will wait for the development of side effect. If there is no side effect in the microdosing, we will increase the dose slowly. That is phase first. Next phase. In phase first, we will slowly increase the dose. And when we will slowly increase the dose, we will check for the safety and non-toxicity profile. Means when we slowly increase the dose, there will be a point when the dose become toxic. Okay, so we will get to know about the maximum tolerated dose of a drug, because after microdosing, when we slowly increasing the dose, there will be a level when we will get to know about the maximum tolerated drug dose, MTD. So this is in the phase first for the human healthy volunteer. After that, we will start trial or we will start clinical phases on the patient. In phase second, we will talk about the effectiveness of the or efficacy of the drug. In phase 3, there will be comparison with the existing drug, which is known as RCT. How we will compare with the existing drug? How we will compare with the existing drug? We will do RCT, randomized control trial. We will take two arms. One will take the new drug, another will take the old drug. So old drug say when we have to compare with the old drug, we will do RCT. So phase 3 is important for the RCT. And phase 4 is the post-marketing surveillance, long-term effect or long-term side effect of the drug, and it is the longest phase of the trial. So when we will release the drug in the market, after phase 3, we will release the drug in the market. And when drug in the market, this is known as post-marketing surveillance. Okay, इसमें से we have so many questions have been asked previously from this. Okay, efficacy of a new drug A is compared with the existing drug B. I have discussed efficacy of a new drug A compared with the existing drug B. So when we compare drug A with the drug B, this is a comparison study or randomized control trial. This is RCT. Okay. And in which stage we are doing it? कौन से stage में करते हैं RCT? Can anybody tell me? RCT कब करेंगे? I am waiting for your responses. When we will do RCT? Okay. So phase 4 was the post-marketing surveillance. This is not the answer here. D will not be the answer here. Okay. Initially, two were in the human healthy volunteer. Last 3 phase for the patients. So phase 3 will be the answer here. Yes, Arpita Singh is correct. Rupali is also correct. Phase 3 is the correct answer. Okay. Next question is maximum tolerated dose of a new drug, MTD. MTD. Initially, the phase 0, and after that we have, after phase 0, we have phase 1. In phase 0, we do microdosing, and in phase 1, we increase the dose up to MTD. I told you this. Okay. Rupali, Pinky, Vandan, Dr. Vandana, Selva, Selvam, Ajay Kumar, and Rupal. Yeah, you all are correct about the previous question. Now, for current question, phase 0 was for the microdosing, and in phase 1, we increase the dose up to the maximum tolerated dose. So our answer will be A. Okay. Pradeep Kumar is correct. Rupali again correct. Rupali Singla, you are good. Okay. After which phase a new drug is launched in the market? after which phase a new drug is launched in the market. After which phase new drug is launched in the market, because after doing RCT, we will release the drug in the market. And RCT, we done RCT in phase 3. So after phase 3, we will release the drug in the market, and in phase 4, we will do post-marketing surveillance. So answer is C. It is very simple. Okay, answer is C here. Next is, this is very important, and preference of epidemiological studies for establishing causality. Very important. Number 1 is the meta-analysis, then RCT, then retrospective cohort, then prospective cohort, then case control, then cross-sectional, and least is the ecological, और उससे भी least case series that we don't do as a study now. What is meta-analysis? Meta-analysis is the study of multiple research papers. बहुत सारी स्टडीज का मेटा एनालिसिस, द एनालिसिस ऑफ मल्टीपल स्टडीज. ओके, मल्टीपल स्टडी फाइंडिंग्स को we can analyze by using the meta analysis. So suppose we have 10 RCT over a disease. If we have 10 RCT, in meta analysis these 10 RCT will be analyzed, will be taken into consideration. Okay, so meta analysis will be the first study for the study preference, then RCT, then cohort, then case control, then cross sectional, and then the ecological. Important है ये. Now we have reached to the screening portion. So in screening, we have true positive, false positive, true negative, false negative. We will revise it rapidly. So in screening, we have 4 things. Number 1 is the sensitivity. What is sensitivity? Sensitivity is the true positive divided by true positive plus false negative. Then specificity. Specificity is true negative divided by true negative plus false positive. Then positive predictive value is the true positive divided by TP plus FP, and negative predictive value is the true negative divided by true negative plus false negative. बहुत सिंपल है. Sensitivity always talk about the true positive, and when you talk about the denominator, take true positive, just reverse false negative. TP का just oppose false negative. In specificity, true negative. To identify the true negative is the specificity. To identify true positive is the sensitivity. These are the 4 formulas we used to use. Now the ability of a test to correctly diagnose the percentage of sick people who are having the condition is called. क्या होगा ये? The ability of a test to correctly diagnose the percentage of sick people the ability of a test to correctly diagnose the percentage of sick people who are having the condition. Suppose a person is having a condition and we are having a test who is correctly identifying the disease, means identifying the true positive. Okay, if a person who is diseased person and our test aims to identify that person is having disease or not, and if 100 persons are sick, and if a test is identifying 100 of them as a positive, that is true positive. So and true positive is determined by the sensitivity. So answer will be sensitivity here, है ना? Ability of test to correctly diagnose the percentage of sick people who are having the condition is called. Suppose we have 100 patient of a disease, and out of them A test identify 90 as a positive, 10 as a negative. It means 90% is the sensitivity. The test is sensitive to identify 90% only. Okay, this is true positive because in real they were having disease. In real they were positive for a disease, and by test they are also positive for the disease. So both side the person is disease, the person is positive from both side. That is true positive. True positive is the sensitivity. अब यहाँ पर if a person, if a test is truly identified the person who is not having the disease, that will be specificity, है ना? So there is a difference between sensitivity and specificity. Sensitivity is the ability of a test to correctly identify those who have the disease, and specificity is the ability of test to correctly identify that who do not have the disease. Okay, means if we have to identify the diseased person, that is sensitivity, and if we have to identify a person who do not have the disease, that is specificity. Okay, if sensitivity will be high, true positive will be high, है ना? And if true positive will be high, false negative will be low. How? Because sensitivity is equal to true positive divided by true positive plus false negative. So it means if false negative will, because sensitivity is inversely proportional to false negative. Okay, so if false negative is low, it means sensitive will be high. Similarly, specificity का formula true negative divided by true negative plus false positive. So specificity inversely proportional to false positive. It means if a test will have high specificity, it means low false positive. Okay, because true negative तो दोनों side है ना, in numerator and denominator both side. True positive will also here in numerator and denominator. But the thing which is inversely proportional is false negative in case of sensitivity and false positive in case of the specificity. Okay. Now this is a question, important one. A test for hepatitis C is performed for 200 patients. 200 patients we have taken and we have performed the test with biopsy proven diseased patient. मतलब 200 patients, they are biopsy proven patient. मतलब 200 are the patients, and we have taken a new test. And 200 patients known for free of the disease. It means if we make a 2 by 2 framework, so diseased, non-diseased, test positive, test negative. Initially, totally diseased person we have 200, non-diseased person we have 200. This is the biopsy proven. Now, the test show positive result of 180 of patients with the disease. Test is saying in the disease 200, 180 are positive. It means 20 are the negative. And the negative result on 150 of the patient without the disease. The patient without the disease are 200. Out of them, 150 are negative by the test and 50 are the positive by the test. This is the framework. Test total positive there are 230 and test negative are 170. Now we have to calculate sensitivity. How to calculate? Sensitivity is equal to true positive divided by true positive plus false negative. यहाँ पर who are the true positive and who are the false negative? बताओ, who will be true positive and who will be false negative? Can you tell me? True positive are the person who are positive from both side. True negative are the person who are negative from both side. इसमें तो easy है. Now these 20%, they are the diseased person, but they are negative by the test, so they are falsely negative. False negative, negative नहीं है, they are falsely negative. Similarly, 200 out of these 200 non-diseased, out of these 200 non-diseased, these 50 persons are the positive by test, so they are not positive, they are falsely positive. Okay, now sensitivity, true positive were 180 divided by 180 plus false negative were 20. 180 divided by 200, answer will be 90%. This is how we can calculate the sensitivity. Similarly, we have four formula. Initially, I told you about the formulas. You can calculate specificity, positive predictive value, and the negative predictive value. You can calculate all of above. Okay, the answer will be sensitivity 90%, specificity 75%, PPV 78 and NPV 88. You just go after the lecture, calculate this and check your answer. Now, one more important question, which is very important here. A diagnostic test for a particular disease has a sensitivity of 0.9, it means 90%, and specificity also 0.9, it means 90%. Single test is applied to each subject in the population in which the disease population is 10%. So if in a population, disease population is 10%, means prevalence of disease is 10%. Okay. So we have sensitivity, we have specificity, we have prevalence. Three things. What is the probability that a person positive to this test have a disease? If a person positive to this test have a disease, means positive predictive value we are talking about. Positive predictive value means out of total positive, the person in real have positive. Person in real have disease out of the all positive. That is positive predictive value. What were the PPV? PPV was true positive divided by true positive plus false positive. These are the person who are positive to this test, and out of them true positive are the person who will really have the disease. Okay, true positive divided by TP plus FP. Now you have only sensitivity, specificity and the prevalence 0.9, 0.9 and 0.1. How you will calculate the PPV? For PPV you have TP, TP, FP needed hai nahi, you can solve by the conventional method. So for this you need to know about the Bayes theorem. Bayes theorem. What is the Bayes theorem? Bayes theorem is sensitivity multiplied with the prevalence divided by again sensitivity into prevalence plus 1 minus specificity 1 minus prevalence multiplied with the 100. This is the Bayes theorem, and you have to remember this formula. ये बहुत important है for the example. So in our case, what was the sensitivity? It was 0.9. What was the prevalence? It was 0.1 divided by again 0.9 into 0.1 plus 1 minus specificity. What was specificity? It was 0.9. So 1 minus 0.9 is again 0.1. Then 1 minus prevalence. What was prevalence? Prevalence was 10%. It means 0.1. So 1 minus 0.1 is again 0.9 into 100. So here we have two things, 0.9 into 1, again 0.9 into 1 and again 0.9 into 1. The answer will be, what will be the answer? Answer will be, when you calculate this, answer will be 50%. 50% will be PPV. So in this question, our answer will be 50%. This is very important question of today, Bayes theorem. Bayes theorem will be very important for you. Now, Kappa statistics, we will talk about Kappa statistics. Kappa statistics, what is this? It is the percentage of agreement between the observer. Two different tests or two different observers may have different opinions. So we have to make an agreement between both the test or both the observer. So here, when we apply two tests, among a population, few of positive from one test and few of positive from the another test, second test. So if we have screening test 1, in screening test 1, few are positive by this test few are negative, and from screening test 2 similarly we have few positive and few negative. And in these tests, A will be the population which is positive by both tests, D will be population which is negative by both tests, B will be the population which is positive by test 2 but negative by test 1, and C is the population which is positive by test 1 and negative by test 2. So this is the framework we have to make here, and examiner will give the answers. Examiner will give the framework or give the values. Okay. After that, what we will do? We will apply the formula K for kappa, AO, observed agreement. Observed agreement means where the observer are agree for the result. So here A is the population when both tests are saying that this is a patient, and D are the value of the or result of the both tests which is same. So A and D, A plus D is the same agreement by both tests. दोनों टेस्ट से same answer from both tests. So observed agreement A plus D. Now we will calculate the expected agreement. For expected agreement, we will calculate A into B with A into C divided by total population. Because this is positive one, yes, this is yes line, this is yes line. Both are the lines of yes. So we will calculate for yes, A plus B multiply with A plus C divided by total values. And for negative line, this is the negative line. Negative line is the B plus D and C plus D. B plus D multiply by the C plus D divided by the total values. Now we will put the values here, AO minus AE, T minus AE. AO we have calculated, AE we have calculated, T is the total agreements. So by this formulas, we can calculate the kappa statistics. It is little bit difficult, but when you solve it, and after the getting the value, what is the value? This is the agreement value. If the value of kappa statistics between 0.41 to 0.6, there is moderate agreement. If the value is 0.81 to 0.99, near perfect agreement. So here is an example. We will rapidly solve the example here. Okay, so 100 suspected cases of ILI, RAT किया इनका rapid antigen test and the RT-PCR and percentage of agreement we have to calculate. So for what are the observed agreement where both are saying that yes and no. 25 are positive by both tests and 55 are negative by both tests. These are the correct agreement by both tests. यानी कि 25 plus 55 that is 80. 80 is the correct here. Observed agreement है 80. Okay, 80 are the observed agreement. Then expected agreement. So this is the yes line. Yes line में 25 and 15 40, and this is the yes line 25 and 5 30. So expected agreement 40 into 30 divided by total value is 100 plus no line. In no line, in negative line 55 and 15 70, and here 60. 55 and 5 60. 60 into 70 divided by 100. So expected agreement will be 14 to 30 divided by 100 is 12, and this is 42. Okay, correct. The total value is 54. Now put the value in K. Kappa was AO minus AE, T minus AE. AO was 80 minus 54, 100 minus 54. Okay, the answer is 26 by 46. It will be nearby 0.45, and when there is 0.45, the agreement will be moderate. So this is the question they might in exam. They will give you MCQ and they will ask what is the agreement, moderate agreement perfect agreement, fair agreement, or substantial agreement, whatever is the agreement. This is very important points, Kappa, because in last 5 years, this Kappa statistics question have been asked in INI-CET twice, and still they haven't asked in NEET PG as far as I know. So this might be come in next exam. Okay. Now we will discuss about biostats. So in biostats, we have, I have a mnemonic for biostats, simple. We have two type of the data. One categorical data, जिसको हम बोलते हैं qualitative data, then quantitative data. So you remember NOIR, N-O-I-R, NOIR. NOIR means N for nominal. When we talk about the names only, yes or no. Ordinal, when there is order. Ordinal means when there is a order. Order means mild, moderate, severe, or TNM classification. These are the orders. I for interval, when there is an interval in the data. What is the interval? Interval of the integer. Integer value should be here. Suppose integer value, what can be integer value? Integer value, number of child is integer value. Number of child can be 1, 2, 3, 4. It cannot be 1.5 or 2.5. And ratio. Ratio when non-integer, and we can convert the data into the ratio. Like we can use a suppose we can use blood sugar. Blood sugar can be 134.5. We usually estimate in the integer form, but it can be 134.5. Height we can use. Height can be in the points, na 5.6. It can be height. So it is the ratio. Now, which test we are using? So for qualitative data, we use chi-square, and for quantitative data, we use either t-test or ANOVA. Okay, when the group value is 2, we use 2-test. When we use t-test, when the groups are 2, and when groups are more than 2, we use ANOVA. Okay, and when in t-test, 2 groups, but groups are like this. Group A and B both are compared together. It will be single t-test or unpaired t-test. Okay, and if we use 2 groups like this, suppose before giving treatment or after giving treatment, pre-test and post-test, that will be paired t-test. Same group is measured twice, that will be paired group. Okay. Now this was about the data. I have already discussed with you nominal, ordinal, interval, and the ratio. Okay. Now nominal and ordinal means categorical data. Categorical data always measured by the median, and quantitative data can be measured by mean, median, HD, correlation, regression, ANOVA, anything. Okay. And ratio is a continuous data. Continuous means which can be measurable in the points. Like hemoglobin can be continuous, 14.1, 14.2, 40.2.5, 14.25. So it is continuous. Okay. Now question, which of the following is a discrete variable? Discrete variable, not continuous. Variable can be discrete or continuous. Discrete means in the integer value or in the form of name. Continuous जहां पर 14.1, 14.2 continuous variation हो. Okay. Which of the following is a discrete variable? Tell me. सो गए? नींद आ गई? नींद आ जाती कम्युनिटी मेडिसिन में, कोई बड़ी बात नहीं. टाइम कम था, वरना कुछ नींद भगा देता मैं. डिनर करने तो नहीं चलेगा सब? बताओ. Discrete variable. Which of the following is a discrete variable? सिंपल है, देखो सोचो इसमें. The question is very simple here. Blood pressure, BP, BP can be 120 by 80, 120 by 81, 120.5 can be. We are not measuring in the form of points. BP we are not measuring in the form of points, but it can be. Okay. Random blood sugar can be 70, 70.1, 70.15 because it is continuous changing. HbSAg, hepatitis B surface antigen, either it is yes or no. Okay. And serum cholesterol is again continuous variable. It can be 150, 151, 155.5, anything. So when there is a chemical test are always continuous variable. HbSAg can be positive or negative. So it will be a discrete data, yes or no. And when there is yes, no, the data will be nominal. So here HbSAg will be discrete variable or nominal data. Okay. ऐसे आप उसको you have to understood like this. The variable को, if we are able to measure the variable in the points, that is discrete, that is continuous. If we are not able to measure the variable in the points, there is only yes, no, it means discrete. Okay. This is about the graph. Okay. So answer Pinky is were telling the correct answer. Roshali is also correct. Dhanu Shweta, Ankit. Okay. So I hope you got it. Now graph mein again we have two type of the measurement in the graph, for quantitative data and for the qualitative data. So just remember a mnemonic: bar pie pictomap. Bar pie pictomap. Bar diagram, pictorial diagram, pie diagram, and the map diagram. They are for the qualitative. Remaining all are for the quantitative. Just like this. Okay. Bar pie pictomap. Bar diagram, pie diagram, pictorial, and the map. These are for the qualitative. Remaining all histogram, frequency, polygon, line chart, cumulative, everyone is quantitative. Line chart is for the trends. है ना? Line chart is for the trends. Now इसको we will discuss by a MCQ. Bar pie pictomap याद रखना. Now scatter diagram we have already discussed in the ecological study. Scatter में in correlation value from -1 to +1. Okay, never will be greater than +1, never will be less than -1. If trend is increasing, this is the positive correlation. This is the positive correlation here, r is equal to +1 or from 0 to +1. है ना? This is the positive side. This is the negative correlation. The value of r will be -1 to 0. And there is no correlation. So scatter diagram or dot diagram, correlation diagram, ecological studies से related. Okay. Next is box and whisker plot or box plot. Box plot में we have divided the data in three values: the smallest value, largest value, Q1, Q2, Q3. Here Q2 is equal to median. This is the important one. Box and whisker में the important one is the value of Q2. Q2 is equal to median. So they will ask in exam, if question asks for the from the box and whisker, that in box and whisker, which of the following, which data or which line is representing the median, Q1, Q2, Q3, or smallest value or largest value, whatever. So Q2 is the median here. This is important one. Now next is, which of the following is used to denote a continuous variable. Continuous variable को denote करना है. तो what is continuous variable? बेटा continue करो इसको. Continuous variable is a quantitative data, and I told you a mnemonic for the representation of data in the graph: bar pie pictomap. Bar pie pictomap. Bar pie pictomap. Bar pie pictomap are for the qualitative data, and they are asking for the continuous. So simple bar is the bar, histogram, question mark, pi is the bar pie pictomap, qualitative, multiple bar is against bar, again bar. So histogram is the odd man out here. So you have to just remember bar pie pictomap. Bar pie pictomap is the qualitative data. Answer will be here is the B, histogram. बहुत simple है. Now type of the sampling we have, just remember the table type of sampling में यहाँ पर question will be asked about the WHO clustering. We will discuss in the next slide. In type of sampling we have two type of the sampling, probability and a non-probability sampling. In probability sampling we have simple random sampling, like we do lottery. This is the simple random sampling. Then systematic sampling, in which we select first number, and after first number randomly selection we will take any nth number. That is systematic sampling. Then stratified sampling, we divide all population in strata and we choose subject from that strata. This is stratified sampling. But in cluster sampling we divide the population in cluster of geography. So when we talk about the geography, it is cluster sampling. When we are talking anything other than the geography, that will be stratified sampling. Suppose we divide the population on the basis of the religion or on the basis of the occupation, that will be stratified sampling. If we divide the population on the basis of cluster, that will be cluster sampling. ठीक है. Then मल्टी स्टेज सैम्पलिंग में डिफरेंट डिफरेंट स्टेजेस पे सैम्पलिंग करते हैं. मल्टीफेजिक सैम्पलिंग में डिफरेंट डिफरेंट फेजेस पे करते हैं. दे आर नॉट सो मच इम्पोर्टेंट. द इम्पोर्टेंट आर हियर दिस वन. ओके. नाउ a pharmacist selected medicines at random from three groups लिए हैं pharmacist ने: plant based medicine, animal derived medicine and synthetic medicine. What kind of sampling method? So what he did, he divided the medicine in three groups बना दिए. So when we divide the population or we divide the study sample in groups, it can be either strata or it can be cluster, either stratified or either cluster. So what is here? Stratified है और cluster है. Okay. I told you about the cluster. When we talk about the cluster, there will be geographical distribution. Okay. So answer, either answer will be cluster here, or either answer will be cluster sampling or stratified sampling, because there is division of the population. But in cluster we talk about the geography. Here there is question is not asking about the geography, so answer will be stratified sampling here. Okay, B is the correct answer. Yes, Shreya, you are right. Then children surveyed in cluster sampling for coverage of national immunization program. It is very repeated question, many times it has been asked in exam. So WHO standard cluster is 30 by 7. 30 by 7. It is the standard cluster of the WHO. 30 districts and 7 children. Means 7 children from each cluster. 30 cluster of 7 children. Okay. This is standard answer, standard question of the WHO. नेशनल इम्यूनाइजेशन प्रोग्राम इंडिया में है, बट WHO से इन्होंने डाटा लिया था ये आइडिया. देन we will talk about the measures of central tendency. Okay, measures of central tendency, mean, mode, median है. Mean is just an arithmetic mean. Average of total values is the mean. In median we arrange the data in ascending or descending order and we select the center value. If there is two center values, we will take average of them. And in mode, what we'll do, we will take the most frequent number as a mode. The most frequent number को हम यहाँ पे use कर लेंगे. Suppose we have value, suppose we have some value 4, 6, 8, 10, 12, 14, 32. So here, if we sum up all the values and divide it by 1, 2, 3, 4, 5, 6, 7. 7 say if we will divide, that will be mean. The center value is the 10 here. It is the median and most repeated. So there is no most repeated. So it is not, we are not able to identify the mode here. But if any value is repeated, suppose 32 is repeated, then 32 will be the mode here. Okay. And this formula, mode is equal to 3 into median minus 2 into mean. This is important for exam also. Okay. Question is, in a bimodal series, if mean is 2 and median is 3, what is the mode? So I told you about the formula. Mode is equal to 3 into median minus 2 into mean. Okay, this is the formula. Calculate. Mode की वैल्यू 3 into median, 3 into median, median is 3, 3 into 3 minus 2 into mean, mean की वैल्यू 2, 2 into 2, 9 minus 4 is equal to 5. So our answer will be 5. The formula, you have to remember the formula. Mode is equal to 3 median minus 2 mean. The formula important. Then a group of children aged 2, 3, 4, 4, 5, 6, 7, 8 underwent a health checkup. What is their median age? For me to calculate the median, we have to arrange the data in ascending or descending order. This data is already in the ascending order. We will take the central value. Central value. What is the central value? 3, 7, 4, 6, 4, 5. 4 and 5 are the central value. 4 and 5. So we cannot have two median. The average of 4 and 5 will be median value. The answer will be 4.5 है ना, simple है. 4.5 is the answer here. Okay, now normal distribution curve is very important for you. In normal distribution curve, it is a bell shaped curve, also known as Gaussian curve, symmetrical curve and unimodal curve. Area under the curve की value either 1 or 100 है ना, either 1 or 100. And what is right skew deviation, what is left skew deviation? In right skew deviation, mean value is greater than median and greater than mode. The value of mean is the greatest in the right skew deviation, and value of mean is the lowest in the case of left skew deviation. ये बहुत important है. This is the right skew deviation. It is the left skew deviation. Right skew deviation is also known as positive deviation. Left skew deviation is also known as negative deviation. ये important है. If mean is the greatest, that is positive deviation or right skew deviation. Is mean is the lowest, it is known as left skew deviation. So they can ask, they can give you a question answer na. For this, what they can do, they can in this question है ना, 2, 3, 4, 4, 5, 6, 7, 8, the value of median was 4.25. now you calculate the value of mean also. इन सबको sum up करके divide करके you can calculate the value of mean. If the value of mean is greater than 4.5, it is right skew deviation. If it is the less than the 4.5, it is left skew deviation. So they can give such type of question also. There will be lengthy question, and now this year there will be only 180, so there will be lengthy question. 20 questions come kiye. This is the 68, 19.5 and 99.7 rule. If the value of standard deviation is plus minus 1, the confidence interval lies in 68%. If HD is plus minus 2, the confidence interval lies in the 95%, and value of standard deviation is 3, the confidence interval lies in 99.7. But exam mein what they give? They give value of HD was plus 1 HD. Now you tell about the confidence interval. So here the answer will be 34. Why? Because if the value is plus minus 1 SD, the answer is 68%. Okay. So now you tell me, if the value of standard deviation is plus 2 SD, what will be the confidence interval? Okay, this is my question for you. If the value of standard deviation is plus 2 SD, then what will be the confidence interval here? Just reply. Very simple, बहुत simple है. This is the mean value, the center value is the mean value, and plus 1 is plus 34 here, minus 34 here. The total range is 68%. If they ask only plus 1 SD, the answer will be plus 34. If they will ask only plus 2 SD, the answer will be half of the 95%. That will be 47.5%. 47.5%. Okay, so it is a little bit tricky question. So when you read the question, remember the sign plus minus HD or plus HD only or minus HD only, because when we read rapidly, na, sometimes we miss the sign. So that's why it is important to see the value, see the sign plus minus HD दिया है या only plus HD दिया है. Okay. The answer will be 47.5 here. Now the next question is, mean is 230 and SD is 10. Confidence limit is 95%. So what will be the range of confidence limit? 95% confidence limit के साथ range क्या है? So when there is 95% confidence limit, it means HD is plus minus 2. Here HD is 10. What we have to do? Mean plus minus 2 HD करता हूँ. Mean value is 230 plus minus 2 HD means 2 into 10. है ना? HD is 10. It means 230 plus minus 20. Plus minus 20 एक बार प्लस करो एक बार माइनस करो. If प्लस करेंगे तो 250, माइनस करेंगे तो it will be 210. 210 to 250. 210 to 250. A will be the answer. Simple है. Shreya is correct here. The answer is 210 to 250. Then test of association, test of significance. So I have already told you about the test of association. Either we have qualitative data or quantitative data. In qualitative data, we will use chi-square. In quantitative, if group are 2 or group are more than 2. If group are 2, we will use t-test, and if more than 2, we will do ANOVA. And if group are 2, but group are one group, we use as a initially pre-test and post-test. Pre-test and post-test means if we are checking blood pressure of a group, and after giving medication, we are again checking the blood pressure of a group, it means it will be a paired group, paired t-test, we will say. And if two separate groups, two different groups are compared, it is unpaired t-test और student t-test. ठीक है, ऑलरेडी डिस्कस किया है इसके बारे में. दिस इज, है ना, दिस वाज द टेबल. कैटेगोरिकल, क्वालिटेटिव, नॉन पैरामेट्रिक. इफ वी हैव टू ग्रुप और मोर देन टू ग्रुप, इन बोथ केस वी हैव पाई स्क्वायर. इसलिए वी विल नॉट डिस्कस अबाउट द डिफरेंशियल फीचर हियर. इन न्यूमेरिकल, टू ग्रुप में वी हैव सिंगल टी टेस्ट और पेयर टी टेस्ट, एंड मोर देन टू ग्रुप में वी हैव NO, एंड वी हैव पोस्ट ऑफ आल्सो. This is for the non-categorical or non-parametrical data. If data is skewed, we can use Mann-Whitney, Wilkinson matched pair test. They are not very much important here. ये just मैंने डाल दिए for the detailed study, but the important one are these. Already we have discussed. Now, test of significance. How we discuss about the null hypothesis. So when we are planning a study, we make a hypothesis. And when we make a hypothesis, initially we give two hypotheses. One is H0. 0 is null. 0 is null. This is null hypothesis. Initially we will say there is no difference between the mean of both groups. Suppose we have taken group A and group B. For group A, we have given an experimental treatment, and for group B, we have given the routine treatment. So our hypothesis is there is no difference in the both group, means both group are the same. Agar if it is proved that both group have some difference, it means null hypothesis, we have to reject the null hypothesis. In alternative hypothesis, actually there is a difference. After doing calculation by chi-square or by t-test or by ANOVA test, if we found the p-value or alpha value is less than 0.05, it means in real there is a difference. Then we have to reject the null hypothesis and we have to accept the alternate hypothesis. Okay? And if p-value is greater than 0.05, it means we have to accept the null hypothesis that there is no such difference. So here, what is the type 1 error or alpha error? Type 1 error, we have rejected the null hypothesis, but actually it was true. Now What is the cliche here? We have two group, group A and group B. Group A को we have given the treatment, new treatment we have given, new drug we have introduced, and group B is taking old drug. Okay, and after doing all the study, we found that drug is better drug, and there is a difference between the response. Okay, drug A is better and there is a response, and when there is a response, value of P will be less than 0.05. It means null hypothesis was saying that there was no difference, we have to reject that null hypothesis. But by any calculation mistake, we found P value is greater than 0.05. This is the calculation mistake, and by calculation mistake we have rejected the null hypothesis while it was true. Initially it was true, but because we have calculation error, what we do, we reject the hypothesis. Okay, and this is create a problem. This is the type 1 error, reject the null hypothesis when it was true, and type 2 error is accept the null hypothesis when it was not true. Okay, and power of test is 1 minus beta. So either you understood this thing, otherwise if you do not understand, just ratlo, you just remember, then type 1 error is alpha error. We reject the null hypothesis when it is true. Null hypothesis were true, but we reject. Okay. Now the question is, in a study, variation in cholesterol was seen before and after giving the drug. Before giving the drug and after giving the drug, there is a difference. There is a variation in the responses. So which test we will use? So I told you, when there is before and after, it means there is paired t-test. Same pair में किया, same group में किया, तो paired t-test. Answer will be C here. Okay. Height. Next question is, height of group of 20 boys aged 10 years was 130 plus minus 13, यानी कि मीन दिया है, plus minus HD दिया है, and 20 girls of the same age was 135 plus minus 7, again mean plus minus HD they have given. To test the statistical significance of difference in height, test applicable for. So what we do here, we have two groups, group of the boys and group of the girls. We have value mean plus minus SD, mean plus minus SD. For qualitative data, we use median. For quantitative data, we use mean. So data is quantitative. So when there is quantitative data, we have either t-test or ANOVA test. If group are 2, we use 2 tests. So here 2 groups are here. So we will use t-test. Okay. In t-test, we again have single t-test and paired t-test. So here there is no pre-post. Pre-post nahi hai. So there will be no paired test. The answer will be single t-test. Answer will be single t-test here. So C will be the answer here. Okay. The next is type 1 sampling error. Type 1 sampling error is also known as the alpha error. Okay. Next is power of study can be increased by. So I told you what is power of study. Power of study was 1 minus beta. So if you decrease the beta, power of study will increase. So by decreasing beta error, we can increase the power of study. Okay, rejecting a null hypothesis when it is true. I told you, just to mug up, rejecting the null hypothesis when it is true is the type 1 error. Okay, rejecting a null hypothesis when it is true is a type 1 error. So answer will be A here. Okay. Next is appropriate statistical method to compare two proportion. It is important one. When we have to compare two proportion, we use chi-square test. Okay, the answer will be chi-square. And what is chi-square test? Chi-square test is a non-parametric test which is used for the qualitative data. It is used for comparison of the proportion, or it is also known as test of association or goodness of fit. And we use to calculate degree of freedom. What is degree of freedom? In any table, there is columns and row. In this 2 by 2 column, in this 2 by 2 column, we have these two rows and these two columns. So degree of freedom will be column minus 1 multiply with the row minus 1. 2 minus 1, 2 minus 1. It means 1 into 1. The degree of freedom will be 1. The degree of freedom C minus 1 into R minus 1. It is very important. Degree of freedom भी नीट का बहुत फेवरेट क्वेश्चन है. They have asked so many times. So just is the question in the table of 2 by 2, the degree of freedom is कितना होगा degree of freedom in 2 by 2? I just told you the value will be the 1. Okay. Now, so I hope you understood today what we have discussed. You have revised all the important concept today, and you will get the annotated PDF of today's lecture on the Telegram group of the DigiNerve. And remember, you just make the concept and be consistent. Consistency is the key of success. And to prepare or to help you prepare better for the NEET PG, PYQs and practices, DigiNerve is currently running an exclusive limited time offer. Check out the details on your screen and in the description below. Click the link now and get the best practice for your exam preparation. So stay calm, stay consistent, and keep learning. See you tomorrow in the next class. Okay, welcome, bacha. I hope you will come again for tomorrow class. Tomorrow we will discuss about the national health programs and silent features. And I will try to reduce the duration of lecture tomorrow because it is approximately more than 2 hours. Thank you.